So I spent the last few days in Port Moresby now, visiting more of our TB projects in Papua New Guinea. Port Moresby is the capital, lots of people moving in and out. A really urban population. I've met patients who have struggled with TB because they have to combine it with trying to work or trying to study. It's really interesting to see how the projects adapt to each different context. Here we actually have got such a heavy burden of TB. We think that by getting more outreach workers, community health workers, almost to people's homes, talking to family members, as well as giving treatment out there for the ones who are not mobile or not able to get into the clinics, is the best way to reduce the burden and also reduce the spread. I'm still wearing one of these when I go out to see the patients in their homes or in the clinics. DRTB, the drug-resistant one, is rampant. It's the one we've really got to get a handle on before we start thinking of the broader problem. But I've met a few officials in the last 2 days who really talk about this as an emergency. It's not emergency as in a cholera epidemic. It's not dramatic because it's slow rolling, but it really is an emergency. I've really been impressed by how MSF works here. It's such a challenging context. It's an amazing place culturally. There's so much spiritual belief in some of the rural areas about how TB is spread and disease being associated with sorcery. And it's one of the massive challenges for us to get that health understanding to the people who have TB, get them to get the diagnosis early and the management.